This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Hilgestrone 200mg Capsule is a vital medication for managing female infertility and hormonal imbalance. It supports pregnancy and addresses various menstrual disorders. Indications and uses. This medication is indicated for the management of conditions such as female infertility, abnormal uterine bleeding, menopausal disorders, and secondary amenorrhea. Additionally, it supports early stages of pregnancy and mitigates risks associated with threatened abortions and preterm delivery. How it works. The medication works by supplementing the body's progesterone levels, which are essential for successful implantation of a fertilized egg and maintaining early pregnancy. Directions for use. Always take the medication as prescribed by a healthcare professional. It can be taken with or without food, though it is advisable to consume it around the same time each day to maintain consistent hormone levels. If a dose is missed, take it as soon as possible unless it's nearly time for the next dose. Swallow the capsule whole with water, do not crush or chew it. Possible side effects. Common side effects may include headaches, breast pain, irregular vaginal bleeding, stomach cramps, nausea, and fluid retention. Contact a healthcare provider if any side effects worsen. Precautions and warnings. Prior to taking this medication, it is crucial to inform a doctor of any existing health conditions, especially liver, heart, or kidney issues, as well as a history of breast or uterine cancer. Regular monitoring and consultation are necessary to ensure safety during treatment. FAQs. 1. Is Hilgestrone safe for those with liver problems? No, it is not recommended. 2. What are the side effects? Common side effects include headache and nausea. 3. Why is progesterone necessary for pregnancy? It aids in implantation and maintaining pregnancy. 4. How long does it take to feel the effects? Some may notice changes within days to weeks. 5. Can it interact with other medications? Yes, it can interact with antifungals and blood thinners. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is greatly appreciated.